From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about radiation therapy for benign conditions. Our guest today is Dr. Kunal Sehgal, Medical Director of Radiation Oncology at the Brian D. Jellison Cancer Institute at SMH. Dr. Sehgal, thank you so much for joining us.
Thank you for having me.
What is LDRT and what conditions is it used to treat?
So LDRT basically means low dose radiation therapy. So these are very, very small doses of radiation, much, much smaller than what we use to treat our cancer patients. And actually, radiation therapy initially, going back all the way to the late 1800s when radiation therapy was discovered and invented, was used primarily for benign conditions. The use of radiation therapy for treating tumors actually came much later in the history of radiation therapy in general throughout medicine. But the basic concept is that we use very, very small doses of radiation therapy to change kind of the inflammatory milieu inside the body, which can actually help a number of benign conditions, most notably osteoarthritis, but also a number of other conditions such as bursitis, which is inflammation of a joint capsule, tendinitis like tennis elbow or Achilles tendinitis, plantar fasciitis, and basically any benign inflammatory condition of the musculoskeletal system.
So you mentioned that this is different from the radiation used to treat cancer. How does it work differently?
Yeah, so the dose of radiation is the main thing that's significantly different. So when we're talking about treating benign conditions with radiation therapy, the entire course of treatment, which is often 5 or 6 treatments, the entire course is equivalent to one dose that we would deliver to a cancer patient. And those patients usually have anywhere from 15 to 35 treatments. So the dose is very, very different. And what we understand is that at those higher doses, radiation therapy is very effective at actually affecting the ability of those cancer cells to divide and continue to proliferate, because that's what cancer is. It's uncontrolled cell proliferation. But at these very low doses, the effect is completely different. We are not trying to destroy cells at all. What we are actually trying to do is to modulate the inflammatory effect. So if you think about arthritis, for example, arthritis occurs for a number of reasons, but primarily it starts with kind of overuse of a joint. So whether that's through aging or high impact sport activity or being overweight, all those things create kind of more pressure and more damage to the joint. Well, the body tries to repair that damage by recruiting in cytokines and interleukins, which are basically inflammatory cells. And those are all part of the immune system. So the immune system is basically trying to repair the damage caused through physical activity, but the repair is not sufficient. And so what ends up happening is you end up with this chronic inflammatory cell environment, and therefore patients end up having chronic pain associated with any of these arthritis or tendinitis or so forth. Where radiation comes in is very, very low doses of radiation are exquisitely effective at eradicating those white blood cells, essentially, or those inflammatory proteins in the body. And therefore, it works actually very similarly to having a cortisone injection to your knee or taking Advil, which is a non-steroidal anti-inflammatory. But instead of having to have an invasive procedure or take a pill every day for months or years on end, a short course of radiation therapy can actually eradicate that kind of environment, oftentimes for 1 to 2 years.
So when would you recommend LDRT over those more traditional treatments like medications, injections, or surgeries for these conditions?
Yeah, so that's a really good question. So, well, first of all, radiation therapy is most helpful when delivered earlier in the time course. So for example, with arthritis, if you have end-stage arthritis, what people call bone on bone, at that point there is no more cartilage. The joint space is so damaged that the bones are really grinding together. At that point, medications, steroids, radiation therapy are likely not going to be of significant benefit. So those patients probably are better suited for joint replacement surgery or some sort of surgical repair. Where radiation can be particularly useful is earlier on in the disease course to try to kind of halt the progression and improve the symptoms. It can be used certainly in conjunction with other things and other medications, but there are some patients that are not good candidates for even a simple medication like Advil because they may be on a blood thinner for their heart, and so their cardiologist doesn't really want them taking other medications that can further thin their blood, so they're not even a good candidate for a simple over-the-counter intervention. Other patients may have kidney issues, and so they can't take anti-inflammatory medication. So this is where radiation therapy can also be an excellent substitute for taking medications chronically. I think the other part is that, if you think about just the historical context, I think years ago, patients and consumers alike were much more amenable to taking medications chronically. I think because of some of the recent changes in the pharmaceutical industry, particularly around pain medications and how people view pain medications, I think that has also changed people's viewpoint on wanting to take medications chronically to manage what is, a long-term, long-standing illness. It's not something that just goes away.
Now, how do patients decide between this and something like a cortisone shot? A lot of orthopedists might use that for arthritis before it gets to bone on bone to try to prolong surgery. What are the benefits of low-dose radiation therapy over cortisone, or would you maybe do both? How does that work?
So you certainly can do these things in conjunction with one another. Many of the patients that we see have already had multiple courses of steroid injections, and they find that maybe the duration of benefit they're receiving is starting to decrease with each injection. So they're looking for another option. So that's one example. And then, as I mentioned, some people are not great candidates for interventions, and even minimally invasive interventions such as cortisone injections. So those are other patients that could be excellent candidates. Or also, like, for example, one of the main areas that we treat with low-dose radiation therapy for arthritis is hands. So now you're talking about multiple joints. So hands and feet, for example. Those are not always as amenable to a steroid injection as maybe someone's knee or elbow, where you have one large joint. So that's an example where radiation can kind of target the entire area and help that patient significantly with day-to-day activities such as typing or playing the piano or even just walking.
Now, with LDRT, is it ever combined with physical therapy? I know you mentioned it could be done in conjunction with some of these other therapies, but is it ever physical therapy as well?
Absolutely. So exercise, physical therapy, lifestyle modifications are critical to the whole process, because when you exercise, you get that joint moving, you improve the flexibility of the joint. Physical therapy is also critical because you strengthen the muscles around the joint to give the joint more stability and not put so much pressure on it, which is the initial problem that's creating the arthritis. So certainly all these things can be used together. And one of the concerns of the radiation at higher doses is joint fibrosis, which could potentially affect joint mobility. But again, going back to what we talked about earlier, the doses of radiation in this case are so low that is not a real concern.
People do hear radiation and get concerned. Even if it's at a low dose, are there any risks associated with that exposure?
Yes. So, when I first even heard about this, because this is not something that we are trained in large volumes in residency programs here in the United States, I was quite surprised that, patients were starting to be treated for benign conditions with radiation therapy, because there is this sort of radiophobia. We know about, nuclear disasters and so forth. With all that being said, as I started to learn more about it, I learned that there is tremendous experience from across the world, namely from Europe, particularly Germany, where, they treat 30,000 patients a year for benign conditions. So in Germany, for example, a third of all patients receiving radiation therapy are actually being treated for benign conditions, not for cancer.
Wow.
And so what we've learned from this vast experience throughout the world is that it's actually very safe, and the risk, particularly for something like a secondary cancer or a secondary tumor forming from this very low dose radiation therapy, is very, very small, on the order of 0.1%, so maybe 1 in 1,000. You also have to weigh that against also the age range of the patients you're treating. So we probably wouldn't be treating a 30-year-old patient with arthritis with low-dose radiation therapy, but somebody who's in their late 60s mid-70s and older. You also have to think about that time course of them. The odds of them statistically developing a secondary cancer becomes, very infinitesimally small at a certain point.
You mentioned a number of treatments, but what does typical treatment schedule look like?
Yeah, so this is a little different than our cancer patients. So these patients with benign conditions are most often treated every other day over the course of approximately 2 weeks. That's the most common course. We then see the patients back at about 6 weeks, monitor their improvement, and then you can consider a second course because, again, the dose is so low. You can consider a second course at about 3 months. And actually, if you look at some of the European data, 60 to 70% of patients will have a significant improvement in their symptoms at about 2 to 3 months. But with a second course, that number comes up to about 90% of patients will have a significant improvement in quality of life and joint function.
How long does each session take, and what should patients expect during low-dose radiation therapy?
Yes, excellent question. So radiation, it's invisible. Patients don't feel anything. They do have to lay on a table in a position that's reproducible. So depending on the joint that we're treating, we have to kind of immobilize that area accordingly. Each treatment is exactly the same as the one prior to it. As far as the length of each treatment, it really depends how many sites we're treating. So if you're treating, one hand, it's probably only 5 to 10 minutes. But if you're treating both hands and both feet, or both hands and both knees, now you're probably talking about 20 to 25 minutes a day on the table. But really, from a side effect profile, the only real side effect I caution patients about is a little bit of fatigue. But beyond that, we don't see, the skin reaction or sunburn and things like that patients worry about from, maybe having a friend who had to have radiation therapy for some other, diagnosis. We really don't see a lot of those issues. The other benefit is you have to think about the anatomy, right? Where are we treating? We're treating distal joints that are far away from any other organs. So there isn't really a lot of collateral exposure that we need to be concerned about.
So patients can continue normal activity
Absolutely.
during treatment? Okay. And they don't have to, you hear about sometimes patients who have cancer have to be away from others as they're undergoing, they don't have to.
Yeah, not at all. We're not treating, most of the experience, again, comes in with the extremities, even if it's like a tendinitis or arthritis. So we're not really treating near active bone marrow, so we should not have any effects on patients' blood counts. So they don't really need to have any precautions. Of course, they're not radioactive, so they could be around all their family, friends, grandchildren, pets. No issues with traveling. So really, no radiation protection is required.
What kind of pain relief or functional improvement can patients realistically expect?
I've been very happy with the responses that we've seen. I've had patients, as I mentioned earlier, that who work on a computer all day, that are really having a lot of issues with typing, for example, say, it's remarkably better. Is it perfect? Maybe not, but it's remarkably better. They have better joint mobility, better quality of life. They're, getting back to being active, exercising, which then helps, as we talked about, weight loss and muscle strengthening. And then all these things ultimately lead to kind of a better quality of life, but kind of functional outcome for the patient.
How long has it usually taken for your patients to notice some of these results?
It does take a little bit of time. So the patients are not going to see a pain response by this, while they're still in the course of treatment. The change in the inflammatory milieu does take time. I would say most patients start to see some response by, 4 to 6 weeks after they finish treatment.
So who should be asking their physician about low-dose radiation therapy?
I think anybody who's been dealing with symptoms for some time, and particularly those who maybe are not great candidates for medical therapy, pharmacotherapy. I think those are probably really like the best patients. But I think anyone who's having really, early to kind of intermediate stage arthritis that's affecting their quality of life, this can be a great intervention to where you don't need to take those medications every day just to have normal function. And as I mentioned, many patients, for 1 to 2 years have great results. And then if they do have a recurrence of symptoms, well, fortunately the dose is low and it's safe to go back and do another course. So that can be, quite helpful. I think in many ways this might be an opportunity to kind of, similar to how injectional treatments have been used. I think radiation could be a very similar intervention to give patients back quality of life.
And we've mostly been talking about patients with osteoarthritis. I know you mentioned plantar fasciitis, bursitis. Are there any other conditions that low-dose radiation therapy can really be good for?
There are actually a host of conditions, wide-ranging actually is what's really interesting. So it could be, somebody has a keloid scar that they want to have removed. Well, if you deliver radiation therapy within really the first 24 hours of the surgery, you affect those fibroblasts, which are what ultimately form scars, from coming in and forming that scar tissue. And so you do a series of treatments over 4 to 5 days for those patients. So here at Sarasota Memorial Hospital, we are a trauma center. So we see a lot of patients that come in after traumatic injuries, may have a hip fracture. So those patients are at a high risk of developing something called heterotopic ossifications, which sounds like a really complicated term, but basically those patients can end up with a big cloud of bone spurs around that joint, particularly the hips. Those are often the highest risk joint. And so these patients first obviously require surgery for the repair of their fracture. But if we deliver a single dose of radiation within 72 hours of that surgery, we can significantly reduce that proliferation of scar tissue stem cells that can ultimately limit their likelihood of needing another surgery in the future to remove some of the scar tissue. In the brain, there's actually emerging evidence for treating, disorders such as, tremors, benign tremors, Parkinson's disease, even some, more behavioral disorders such as obsessive compulsive disorder with very targeted radiation therapy. And actually now at the new Cancer Pavilion here at the main campus, we're going to have some new technology we're fortunate enough to have that will allow us to treat these very, very small sub-millimetric targets with very focused, highly precise radiation therapy. There's even interest in treating cardiac patients who have arrhythmias, certain arrhythmias, ventricular tachycardia specifically, that are kind of very refractory to medical therapy and even device therapy such as pacemakers, actually trying to ablate those areas with radiation, those nituses for the arrhythmia. So there's a lot of growing interest in radiation therapy for really a variety of benign conditions.
And theoretically, it will continue to expand.
Certainly. Yeah, I think it's going to be a whole new, we used to call radiation oncology radiation therapy, and then it became sort of very oncology focused over the last several decades. But I think we're kind of seeing a renaissance of the term radiation therapy because we're going to be using radiation for much more than just taking care of cancer patients in the coming years.
So if patients are interested in finding out more about low-dose radiation therapy or maybe have one of these conditions we've talked about and live locally, do they need just a referral from their physician?
Yes, so their primary care physician can submit a referral to our department. We see everybody in consultation, go through their images, look at their state of exactly what they're dealing with, and then make a recommendation accordingly. So those are, hour-long consultations where we really spend a lot of time with the patients and get to understand what are their specific needs and whether or not we think we can provide benefit to them.
And this is done at the Brian D. Jellison Cancer Institute in the Radiation Oncology Center on University Parkway, as well as the new Millman Covert Cancer
Absolutely.
Pavilion.
Correct.
All right. Dr. Sehgal, thank you so much for joining us and answering all these questions.
You're welcome.
If you liked this episode of HealthCasts, please like and comment. Visit smh.com/podcast to listen to more experts like Dr. Sehgal talking about health issues which matter to you. As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.